As this chart shows, we managed not only preserve, but to significantly elevate healthcare capacity in Idaho during the pandemic for 7 straight months. Last week, things changed for the worse. Idaho is at a critical juncture. This is unacceptable, and we must do more. Today, I'm signing a statewide public health order moving Idaho back to stage 3 of our Idaho Rebounds Plan with some modifications. What does that mean? It means indoor gatherings are limited to 50 people or less with physical distancing. Outdoor gatherings will be limited to 25% of capacity. It means distancing requirements are in place for gatherings of all types. It means long-term care facilities will not be allowed to operate without requiring masks. It means we are requiring seating only for bars, restaurants, and nightclubs. It means employers should continue to protect at-risk employees by allowing telework or by making special accommodations for those individuals in the workplace. It means all individuals and businesses should follow recommended protocols for minimizing transmission of the virus. All of this information will be available at rebound.idaho.gov. What this does not mean, it doesn't mean our economy is on lockdown. Our economy will remain open. It doesn't mean in-person church will end. It doesn't mean we're restricting travel in or out of the state. It especially doesn't mean that we should go to full remote learning in our schools. We put millions of dollars and substantial efforts towards the safe opening and operation of our schools to ensure they are safe places to learn and work. The state rolled out a back-to-school framework in the summer, providing local school leaders a blueprint for safe opening. To the school district trustees and administrators who have done a good job of protecting teachers, students, and families, thank you. Our students fall too far behind when they're away from their teachers and classmates. We must continue to prioritize safe in-person learning for students across Idaho. My decision to implement a new statewide order was not made lightly. I want to be very clear about something. The localized approach is still my desired approach in protecting lives and our economy. When Idaho had its first confirmed case in March, we put in statewide measures to slow the spread of COVID-19 while we worked to elevate healthcare capacity across the state. Idaho is expansive and communities and their needs vary greatly across the state. The eventual shift to a localized approach was the right thing to do, but has not worked as well as it should because the virus is relentless. And in some parts of the state, there simply has been insufficient efforts to protect lives. Local public health boards and locally elected officials have the authority under Idaho law to implement and enforce measures to reduce COVID transmission in their communities. And we have been in regular, constant communication with them about the need to implement local measures where needed. Some health district boards, mayors, and county commissioners have done the right thing and made the hard decisions to successfully slow the transmission in their communities. But there are other parts of Idaho where not enough has been done, even in the face of an overwhelming need for action. The no action approach for dealing with COVID is not a responsible option. I ask my fellow Idahoans, please support those leaders who have acted and communicate to those leaders who have resisted acting that they need to recognize the urgency of our situation for our health, for our economy, and to keep our kids in school.